Hey, this is episode 2, Living with Pancreatic Cancer. Today I'm going to talk to you about my experience. It was mid-October 2023, and they recommended me getting a chest port, okay? So what happens is when you get cancers, and they're always doing blood tests. So I remember the first 3 days that I was in, they had to do tons of IVs. I had an IV on this side, IV on this side, and so I had 2 IVs going at the same time. After a while, your veins start collapsing. So they recommended me doing a chest port. Okay, what that means is right here they'd make an incision about an inch long. They put a device that goes in there and it goes up into one of your veins. So it's a direct port into your veins. So there is no more doing IVs and drawing blood. They draw the blood from there, and they also inject your chemotherapy. So I went to a radiologist, and it's a day surgery, and so they do a local. They cover your head, and basically when you're done, you have this big bump in your chest. It's upper chest, and it really helps because first of all, when they do the injections, it's only piercing the skin, and they usually do like a lidocaine on it. So whenever you're getting your injections or blood drawn, it's not that painful. But also they have a good place for it, so you're not having all these collapsed lungs or different holes all through your arms either. So I know that might be scary, but I do suggest that if they offer it to you 100%, I do suggest that. It'll be a couple of days to recuperate, but very, very glad that I went through that course. So I wanted to talk to you about, so once I got my results, and I sat down with my oncologist, and he told me the results, and I agreed to the FOLFIRINOX. What was my daily life going into treatments? So once every 2 weeks, this is what would happen. So I would go there first thing in the morning, and by the way, FOLFIRINOX, if you don't know, is probably the most harshest chemotherapy regimen known. It's typically meant for end-of-life patients. So they wanted to hit it hard, treat it, and I said go for it. I didn't know all the answers. I was scared. Certainly I wanted to fight. I wasn't going to be naive enough not to do it. But I also had questions. So I was still waiting to hear back from Dana-Farber. But I said, let's just go at it head on and do this. So I went in the first day, and something happened. My labs weren't there in time, so they canceled on me, and they pushed me out another week or two. So the doctor said, we don't want to wait too long. We want to get this done right away. I said, okay. So, and I'm just thinking the worst. I'm thinking like, maybe a couple months, 6 months tops. And, any given time moving forward would be great. So here's my daily experience, okay? So we are going to take, in my view, what I experienced during chemotherapy. So I would go in like first thing in the morning. We'd get up at 6:30 or 7 o'clock in the morning, drive down to Concord, get there, check in. They were really nice. Concord, New Hampshire Oncology is really nice people. And so they would put me in to do a blood test, and I sit back and wait for my blood test to come in. And then they would get cleared with the medication and the provider, and then I would go into the room. So I found a nice cozy corner room that had it was nice and warm next to a heater. I think it was definitely a good thing. A lot of times they ask you if you want warm blankets and stuff. So I watched the whole room fill up. And and so and I'm looking at all these people and they have like one bag and I'm looking at some people and some people don't look good. Increased my being scared. But I also thought I had it inside to move forward. So the first bag they put through my chest port and they hooked it up and two nurses would sign off on it. And I looking around and basically we're going through the same thing. So the individuals across from me or around the room are all going through chemotherapy treatment. So my first bag, it made me nauseous like you have the flu. You get some weird taste in your mouth, you start sweating profusely and just clammy skin, just you don't feel good. It's almost like you're having a flu, okay? So then that would happen for about 2 hours. And in the meantime, I watched all the other people that came in and they're all leaving. So they do their one bag and they're leaving. I'm like, oh, that's weird. They only do one bag. And so then all of a sudden they come up with two more bags, two separate chemotherapy treatments. And I don't recall all the what they were, but I know that one was I'd like to say oxyplatin for some reason. But anyways, this one was different. So they would set me up with two different things, and I watched 10 or 15 people more come into the thing. So the first group left. I'm getting set up for two more, and then a whole new group comes in, and I have great support. I mean, my wife would be there, or my friend Randy, and so I'm sitting there, and now this one was really harsh. The two was not well. It made me cold. So I went from being hot to cold. Also, my vision was very blurry. It was kind of weird. Gave me like a numbness of my face. And then all of a sudden I felt like I had to go to the bathroom all the time. So for that 2 hours, I had to get up, take my cart into the bathroom, go to the bathroom, and I felt like I went pee like 5+ times in the 2 hours. So plus they're putting a bunch of fluids in your body too. So that didn't make me feel well at all. And then so as I'm doing those 2 hours, I watch 10 people leave and 8 to 10 people come back in. I'm like, wow. I go, I'm still here. Been here since the crack of dawn. And there's a third set of people I've seen to get their dosages, which didn't really make me feel special, but I guess I was a special treatment because they just hit me all at once. And I didn't really think much about it, but they were really hitting me hard with a lot of chemicals. And the other people, and some people they can't handle it. Their bodies just cannot handle that type of chemotherapy regimen. So lastly, they come in and they hook up this high-powered pump. They said, I'm going to be taking this pump home. And so they flushed out my port. They put the saline back in my port, and instantly I could taste it in my mouth, which is really bizarre. It's like a metallic taste when they flush out the port with the saline, because it goes right through your body instantly, and you can taste it, and you can actually feel your whole face get flush. And so then they had a prime for the pump. They had to prime my port, and they have this big giant tube, injection tube, and they pushing it through. And my eyes would literally roll back in the back of my head, like almost like a blindness type of thing. Your vision's really dark, and it just really harsh stuff. Then they hooked up the pump, and so I had this pump attached to my side, and so they would send me home with this pump. And I was talking to the nurse. I'm like, how come I don't just get the 4th bag? And she was like, oh, this stuff's so caustic that if you took that bag on a 1 or 2 hour thing, you could probably just pass away. I mean, it's meant to give you small little doses over the 24-hour period of time. That kind of scared me. I'm like, this stuff is so bad they couldn't even give it to me within the hour or two. They had to stretch that out for 24 hours. So I did this, and I went home, and I would literally be so cold. I mean, I would be shivering under the blankets. either electric blanket on me, hat on, I had gloves on, and I felt like I was an infant. I was just in bed, really cold. And then a few hours later, I'd wake up and I'd be so hot, like a hot flash, back and forth. And I just slept for like 12 hours straight. Woke up in the morning, after sleeping most of the night through. People just left me alone. They gave me a lot of space. They checked up on me, but it wasn't the greatest feeling. So when I woke up in the morning, I knew that afternoon time, I had to, once the pump got close to being the end, right, because it's 24 hours, it would beep and say you're getting low. Once you're getting low, you have to drive back to the hospital. And then they shut the pump off, they flush your port out, and then you go home. So you had a big dosage in that 24 hours. So I did that for a few regimens, and then luckily I did keep the Dana-Farber commitment because I just wanted a second opinion. So I did that for Furanox for a 2-month cycle. They told me I was going to be doing another cycle soon after, but I wanted to get a second opinion before I move forward. And I did hold that appointment with Dana-Farber, and I did an intake with them, and I set an appointment. So that was the life of how chemotherapy goes. So on the next video, I'm going to share with you what I went through for Dana-Farber and how I stopped this original treatment. And I'll tell you all the things about that on the next video. Thank you for getting on this journey. Please subscribe to my YouTube channel. And again, living with life with pancreatic cancer or any cancer is a challenge. And there's hundreds of thousands of people across just the United States, never mind the planet. And rest assured, we have some of the best minds in the world in United States hospitals. So just make sure you get your research done and don't take no for an answer. If you want more answers, go get them. It's very important. Well, thank you for the listen. I'll be here. I'm going to do another video in a few days about my consultation into Dana-Farber Cancer Institute out of Boston, Massachusetts, and why I then went with them after that. Take care. Have a blessed day. Talk to you soon.